All right, passing the NAPLEX isn't about just memorizing more information. It's also not about what you think it should cover. It's about mastering what is testable for any entry-level pharmacist. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from the what to the why, because knowing the why allows you to master the how. And the question here for you is how to pass the NAPLEX on your first try. So on this episode, I'm going to show you how to identify high-yield, testable concepts that the committee creating the exam can actually count. In addition, knowing this insight separates first-time test takers who pass from those who have to repeat. Now you might be asking yourself, what qualifies me to talk about this subject? On a high level, yes, my training as a nurse and a pharmacist and a physician, but I've been very fortunate to pass all of those licensure and board exams for the various specialties on my first try. Being a pharmacist means that I obviously also took and passed the NAPLEX. I've also been involved in teaching pharmacy for over 25 years. My experiences taking so many of these exams has allowed me to see a common theme about what is testable and what is not. Knowing that helped me to focus more on what to study to pass these exams. So my desire in covering this topic is to invest in your success. I want to see all of you pass on the first try so that you can enjoy the fruit of your labor just like I did and my colleagues. I've also seen over the years why so many students fail. They study and focus on the wrong material because of what they think they need to know versus what is on the exam and that the exam is able to test and not test. I've also seen people carrying around books thinking that everything they need to know in certain books is the answer. If that were true, the NAPLEX pass rates that continue to decline for the last 10 years makes no sense if everybody's using a book. So we need to focus on the right things. So let's first talk about the process of developing the NAPLEX exam, which then helps you to understand the framework, basically the blueprint, for what then should be tested. So the NAPLEX is developed by the NABP, and they're meant to be there to evaluate entry-level competence for pharmacist licensure. That means not residency-trained knowledge, not expert-level knowledge, not even knowledge only in certain practice areas like community or inpatient. The purpose of the NABP is to ensure that the content on the NAPLEX is fair, validated, and testable using an evidence-based process that prioritizes, listen, well-established standards of care through the use of practice analysis surveys, experts in the field, and psychometric validation. And here is one of the main points that I think good test takers truly understand. Knowing this information actually helps those learners prioritize study materials aligned with validated entry-level practice instead of these controversial and new emerging areas of clinical practice that are important but not tested. Okay, so let's now walk through the basic steps that create that framework, the blueprint of the NAPLEX, so that it makes sense on what is covered and testable and not. So we talked about a practice analysis, a survey. All right? These form the foundation for identifying critical knowledge, skills, and ability, known as KSAs. This is usually developed and implemented by a panel of diverse experts who then draft some of these KSAs They have to do a broad validation of the survey amongst the practitioners in the real world. And those respondents of the survey rate relevance, suggest weightings, provide feedback, ensure content reflects real-world evidence-based practice rather than region-specific, niche, or debated issues. This then allows the exam blueprint to be developed. The survey results help to organize KSAs, again, knowledge, skills, and abilities, into a publicly available blueprint or outline of the exam content, which then further they break down the question distribution in percent. That gives you some guidance of where the majority of the question content is going to be directed. It does or should exclude non-testable, non-essential concepts and focus rather on entry-level competencies. Now, this process of doing this is updated periodically because practice changes, and that's usually every couple years. Now, that blueprint is developed, you got the framework, now you got to do question writing and a review of those. So this is where the subject matter experts who are trained in best practices write items that are linked back to that blueprint and those specific domains. And each question is meant to test a single evidence-based concept with current literature reference support. Now the committee then reviews for accuracy and then revises or deletes substandard items. It also conducts editorial checks. They're all with emphasis towards established guidelines and standards of care. Why does this perspective matter, guys? It matters because nothing brand new or that has come out in the last really probably 12 to 24 months is likely to be tested and count. It takes that long to get new content to be validated and supported by everybody in the country and then count towards the exam. It also means that your exam can only reflect the standards of pharmacy practice around the entire country versus maybe what you learned at school, your local hospital, or ambulatory care clinic, which sometimes is influenced by regional providers. Thus, brand new content, new guidelines, brand new drugs, topics still being debated. They're important, yeah, but you shouldn't waste your time studying it for the exam. Now, is it clinically relevant to think about those things? Of course, sure. But it's not testable, guys. Don't hyper-focus on that for the exam. Instead, spend time studying your core knowledge and understanding why you do the things that you do as an entry-level pharmacist. You might be asking, okay, that's great, and I'm all good with studying a little bit less or only what I need to for this exam, but what content does that still represent? I mean, I haven't taken the test, right? And I'm still not at an entry-level practice environment, right? It's a good question. It's a good perspective. First, evaluate the NAPLEX study guide and the content, right? They produce that. It's available publicly, okay? You'll see the distribution of domains and objectives and where the percentage of the exam, all that. And they change it sometimes, but quite honestly, it doesn't really change that much of what you're supposed to be doing, okay? I don't mean any disrespect to the process. I've read them over the years, and many of those objectives and domains are very vague, very broad, right? They don't tell you what drugs, what disease states, what labs, none of that, right? So you kind of have to know all, or you have to have some way of identifying what then is the standard of practice. Well, how do you do that? Well, you need to find one or two resources that can point you in the right direction. Those resources usually should be developed by people who have been doing this for years and understand what's important. This is one of the reasons why I developed high yield med reviews. I mean, students just kept asking how they could learn to understand because they were being given stuff to just memorize. Memorization of content doesn't mean you understand it. It means you know how to regurgitate information. And so I developed a Q-Bank and practice exams to not only give you that practice, but also to help you to learn the concept. So why does a Q-Bank matter? Well, because you need to be practicing what is being expected of you. And on the exam, you're being expected to answer multiple choice questions and apply core knowledge. So you should be answering hundreds, maybe even over 1,000 practice test questions, because here's the reality. No one has the exam. There's no book. There's no lectures that are going to solve it all for you. Instead, you have to practice applying what is expected of you so that whenever the test gives you, you're going to be able to answer the question, understand the concept, know why a concept is what it is and how to apply it. So if your resource isn't pointing you in that direction, and all you are finding yourself doing is memorizing, you're likely not going to pass. I don't mean to be negative. I don't mean to be disrespectful. My goal is to see you pass. There's no value, there's no benefit in failing. You're just delaying the movement into your career and paychecks. And if you're going to residency, you might lose that spot or you delay it. That's pointless, guys. My goal here is to facilitate your success. And that's why we're here, to invest in each other. Help us understand why we do what we do so you can do what? Master the how. And the how in this case is how to best study and pass the exam on the first attempt. And that comes with knowing what is testable, guys. So I hope you found that to be helpful, and we'll see you next time.